Colorectal Cancer Awareness Month, and with recent death of James Van Der Beek, the well-known actor from that particular cancer, it is again raising awareness for when people should get checked out and what are the signs and symptoms of this particular disease. Joining us today to talk about this and more is Dr. Allan Thornton with Hampton University Proton Cancer Institute. We appreciate you for taking the time for this very important conversation that will hopefully help some people get treated when they need to, Dr. Thornton. So we appreciate you for joining us. Our first question that we have here is simply, what are the signs of someone who is experiencing colorectal cancer?
Well, so first of all, colorectal cancer is a rather diverse description. It generally refers to tumors anywhere along the intestinal tract, the end of which is called the colon, but also in the rectum itself, the very end next to the anus. And so the symptoms are a bit different depending where along that tract it is. But in general, any evidence of bleeding, bright red blood would be indicative of the possibility of a tumor down in the anus or in the rectal area, or a change in bowel habits, such as going to the bathroom more frequently or less frequently. And an important change of characteristic is the change of the size of the stool, the character of the stool. Is it becoming more thinner? Is it becoming less in diameter? That can be an indication of a tumor that is squeezing the bowel. So observation is important. Those are some of the early characteristics that we should look for.
You know, I'm so glad that you mentioned that it is kind of wide spanning, because I know a lot of conversation too kind of kicked off years ago when we saw another actor, Chadwick Boseman, die of colon cancer. Could you maybe specifically speak to what are some of the differences between colorectal and colon, if there are any?
Well, sure. So the colon itself has different sections. So there's the part of the colon that goes on the right side of your body, that generally goes from the bottom up. The bowel, the stool is going from the bottom up from your appendix area. And then you've got the transverse colon, which goes across the top of your abdomen or stomach. And then you've got the descending colon, which is over on the left side. And that's the part that interfaces with the rectum. And so generally, most of the tumors appear to be over on the left side. That's what's usually seen, but some can be on the right side, and there are different features. Now, the lesions that I was talking about before, the napkin ring lesions, those are the ones that are circumferential in nature and can constrict the bowel and oftentimes cause chronic constipation and pain, and with that, some spasm and even a colicky type pain, which can happen every 5 to 10 minutes type thing. Those are oftentimes in the transverse and descending colon as well. But those are the indications that those are some of the symptoms that we'll see. The ones that are down at the in the rectal area, lower down in the terminal colon and the rectum area, those oftentimes are ones that have bleeding, and you'll see bright red blood. And they're hard to distinguish from hemorrhoids, for instance. And that is exactly why we do tests. That's why we want folks to do colonoscopies and proctoscopies and formal examinations here to distinguish those from hemorrhoids, for instance.
I actually have a good friend where that was the process they had to take. Fortunate it was not diagnosed as cancer, but you mentioned it can oftentimes be hard to distinguish off the first look from hemorrhoids there. You know, we're talking about this during this particular awareness month, and it just so happens again that we have this high-profile death because of colorectal cancer. What are some of the things that you find people don't quite understand about this particular cancer, or that they simply maybe mischaracterize about it?
Well, a lot of folks think that it is only an old person's disease. They think that it might only happen when you're 65 or older, and I hesitate to call that being old because I'm older than that. But it not necessarily. It is becoming more and more recognized in younger folks. Folks in their 20s, 30s, and 40s even. And so it's important for any change of stool habits to be noted. And don't be shy about it. People oftentimes are hesitant to go to the doctor about it because they know that the testing might require a colonoscopy. And yes, a colonoscopy is an event that you have to take a day of work off from to do. But this is so important because this is truly life-saving in your early diagnosis, and you do not want to delay this, is what I'm trying to say. So.
Speaking of that delay, I know when Chadwick Boseman died, there was a lot of conversation about the time in which people should get checked, right? You have the certain time frame in which it is advised for you to do so, but there was some talk on whether or not that should happen even earlier. Can you again break down maybe what's the earliest, even if you don't see symptoms, that right now it's required, but maybe how soon could someone get checked if they want to do it early?
Well, I have actually treated a person as young as 25 with colon cancer, so that is exceptionally unusual. But it does happen in the cases of chronic inflammatory bowel disease. You've perhaps heard of processes called ulcerative colitis and Crohn's disease. These are chronic inflammatory conditions of the bowel. And some of these people, not many, but some of these people, I believe it's less than 5% of them, actually have these conditions associated with genetic conditions. And those can cause a very high incidence. They are correlated with a high incidence of colorectal cancer. And those folks who have a family history or diagnosed conditions should absolutely get scoped more frequently. Some of them as much as every year. That's a minority of patients. Most patients are not in that category. So for the 95% of people who are not in that category, again, any change of bowel habits is really a prompting to confer to your medical professional. Now, we usually want folks to get colonoscopy starting at 45. That's the standard basis, and then we repeat it every 10 years, unless you have symptoms, and unless you have a family history. Certainly at 45 is when you should start. And then we usually go up to age 75, but I say it really can go higher than that. It depends on the condition of the patient. So.
Yeah, I was looking at the ages. Vanderbeek was 48. As we know, Chadwick Boseman was just a little bit younger, I believe, at 43 years old when he passed away. Again, we're talking with Dr. Allan Thornton here as we are entering into Colorectal Cancer Awareness Month. And Dr. Thornton, again, we appreciate you so much for taking the time here. Now, I just would like to ask you kind of what you all do at the Hampton University Proton Cancer Institute, because you also are a resource for people here in the area of Hampton Roads. And so how can people maybe take advantage of what you all have to offer and to connect with you?
So we are a rather unique facility in that we use a different form of radiation here. I personally have been doing this for well over 35 years, starting at Harvard years ago. But this, we use proton therapy. We accelerate the center of hydrogen atoms, protons, to two-thirds the speed of light. We're really kind of a physics laboratory in disguise here. But the advantage of them is that we can control how far the radiation goes. And so I've been using this for many years to treat patients with tumors around the eyes, at the base of skull, around the spinal cord, next to critical structures, particularly also in children, where I do not want to cause late effects. I do not want to injure that child. I treat brain tumors. I treat children's brain tumors as well. So these are critical issues, and we treat, of course, many prostate patients, but we also treat rectal patients. And in fact, we wrote a protocol when I was at Mass General Hospital in Boston specifically to treat patients with rectal cancer with protons because we can spare the bowel in front of that area. We can give them a higher dose with protons than you can with X-rays without hurting the bowel, which is in front of the rectum, in front and above it. So we treated a number of patients with tumors in critical sites.
And I know we've done multiple stories and coverage there, and we even have a commercial that's on right now on our air with two of our reporters here in partnership with what you all are doing there at Hampton University Proton Cancer Institute. Any last things that you would like to share as it pertains to colorectal cancer that you think that our viewers could really benefit from, that you would really want them to know?
Well, it just in reviewing for this morning's talk, I was just reading back through the literature, and it became apparent to me that it appears that colorectal cancer is very intimately connected to inflammation. Inflammation of the bowel, general body inflammation, and that can be caused by tumors, yes, but can be caused by illnesses, stress, change of foods, chemicals, anything that causes chronic inflammation can put the bowel at risk, infections as well. And so, anytime that your bowels change in habits, that's not something to bury your head in the sand about. That's something to bring to the notice of your doctor who knows you well. And a simple thing is to get a stool screening test, just a sample of your stool, called an FIT test. Or if colorectal, you've probably seen these Cologuard box commercials on television. Those can be done. Or if a colonoscopy is in order, get those. But there are a number of very non-invasive tests this day and age that are available to you, and I would implore our viewers to avail themselves of this technology because it is out there, and it is not a reason to not pursue it. Please do.
Thank you so much for taking the time and talking with us again. That's Dr. Allan Thornton, Hampton University Proton Cancer Institute. And of course, obviously, diet, exercise, all of those things go into this conversation as well. But hopefully, if you are listening in, these are some good tips for you to have. And hopefully, it can also help you just in the case you see some signs and symptoms to know. Don't wait. Don't wait. That's what the good doctor is saying today. Don't wait. Please get it checked. Dr. Thornton, thank you so much, and have a great rest of your day.